Good morning. I'm Dr. Marc Cooper, and I'm here to talk to you about a stop smoking program. And the reason a stop smoking program is so important in chronic pain management is because everyone knows that a smoking program causes cardiovascular disease and interferes with heart issues and vascular flow. But they don't know, and a lot of people don't understand, that that smoking interferes with your healing, especially with issues like degenerative disease and arthritis and after surgery. So it's really important to do a stop smoking program if you have a condition, any sort of chronic pain condition. So one of the strategies I found is very useful is combining a pattern intervention strategy, which we call that in psychology, with with an essential oil. And the essential oil that I happen to like to use is the one called peppermint oil. Now here's the way this works. I have people first, they go ahead and smoke for like they have been doing all along. So they get up in the morning, start their cigarettes at 7 o'clock, smoke all day long until about 11 o'clock when they go to bed. Okay? But the next day, they stop at 10 o'clock. And then the following day, it's 9 o'clock. And then it's 8 o'clock. And so they are gradually moving their cigarettes back an hour. So they're only having to try to beat the addiction 1 hour at a time each day. But there'll come a time when you're really going to desire a cigarette. There's going to be a phone call that upsets you, or after supper when you eat, or after a drink a cup of coffee, and you're really going to want that cigarette really bad, and you're having this battle inside saying, I don't want to smoke, but I do. And so you're having this internal battle in your head, and you're just about to give over and break your pattern that you've been doing so well and start smoking again. So this is when this essential oil comes back into play. It is a backup plan, so to speak. And so what you do with this essential oil is that, let's say it's 6 o'clock in the evening and you just got to having dinner and you've got a phone call from one of your kids and they're upset about something. It's made you nervous, and the first thing you want to do is grab that cigarette and walk outside and smoke that cigarette to get calmed down again. But you don't want to do that. So what you do instead is you take this peppermint oil and you drop it, a drop right here. And you don't want to get it on your fingertips because you don't want to put it on your eyes, but you drop it, one drop right here, and then you lick it off. You sit back and you swirl it around in your mouth. And you breathe it in like you would your cigarette, really deep. And you blow it out slow. Now what you're going to notice is that there's going to be a rush. It's going to open up your sinuses, it's going to open up your lungs, it's going to give you a very strong taste, and you're really not going to like wanting to put a cigarette in your mouth at that point. And it's going to give you a window of opportunity there to kind of get your mind on something else besides the smoking. And hopefully that'll be able to break that pattern so you can go back to your original program of where you're dropping the cigarettes off 1 hour at a time. Period. I found this to be very helpful for patients, and they've been very successful in being able to stick with their program of stop smoking and bringing it back. And so I hope this little technique helps you